Hi, I'm Dr. Reg Bell, and I wanted to talk to you about one of the most common reasons that we see people in the Surg 1 Foregut Institute, and that is patients who have problems with heartburn or reflux. And you may well be one of those patients who has been on medication and has just found that it doesn't work adequately to control your symptoms, and you're looking for options. One of the things that I'd like to point out to you is that medication doesn't really address the root problem. It really covers over some of the symptoms. Reflux is due to a problem with the valve or the sphincter mechanism at the lower end of the esophagus that opens up too easily or too often to allow stomach juice to come back up into the esophagus. Medications don't alter that valve mechanism at all. What they do is they simply decrease the level of acidity in the stomach so that what comes back up is less irritating. There are surgical ways to rebuild that valve mechanism so that it functions in a much more normal fashion, so that we can enable it to open up during swallowing and then close up afterwards to prevent reflux. These surgical procedures are what we specialize in, and when we see patients like you, we like to take a thorough history. We may order some tests to make sure that we're doing the right procedure, offering the right things. And then we'll sit down with you and talk about what those various treatment options are. Sometimes it involves a procedure that we can do without any surgical incisions. Sometimes it involves a procedure that involves making very small incisions to go in with operating instruments and take care of the problem. Most of these procedures are same-day surgery or overnight surgery stays. And when patients go home, they can do normal activities of daily living right afterwards. Because of these minimally invasive techniques that really address the root problem, we can offer patients an improved quality of life compared to anything that medication can offer. And we hope when we see you that we'll be able to listen to you and devise the best treatment plan for you to help you be rid of your heartburn, regurgitation, and on to living a more normal life.